Is that clear? If I lift this brow, this area will look little clear. So that puffy eye bags will lift it up. So that will give you a younger and brighter eye and the face. That means you look young. You look young. Other option, otherwise we have to remove this bag surgically and lift this brow surgically. That's the other option. Look at this picture. See that? A big eye bag here. So we have to remove the eye bag and lift the brow surgically. Or non-surgically, you give some Botox to lift that. Look at this eyebrow shape. It lifted up, lifted up. It's very flat. And it goes. So it gives little brighter look. This very dull look. This gives a brighter look. So that is a non-surgical brow lift. This is other way around. Some people have a brow is up, one brow is up from birth for some reason. So we had to balance it down. It's like a brow drop, eyebrow drop, opposite to the brow lift. That's also we do. We make this eyebrow parallel or similar, symmetrical with other eyebrow. So either we can drop it, we can lift it up. We can lift it up or drop it up with this thing. Okay, same thing. The eyebrows are not symmetrical. One is down, one is up. We can balance that. We can balance that. This is, some people have showing the sclera, the white part at the bottom level too much. This should be like this for the normal looking eye. Here, if you look at that, the white part is showing more. Yeah. We can correct that with the Botulinum from here to here. So this is coming down, and you see more white part. It should be like this. So with the botulinum toxin injection, it goes up and cover the white part. Yeah. Jawline, jaw shape. What kind of jaw shape you like? Is it a box shape, or oval shape, or heart shape, or moon shape, round? Which one you like? Jawline. Which one you like? Ideally. Is it oval shape or box shape? I will tell you one. Oval shape. Oval shape and the heart shape. This is popular. Nobody like V shape. Yeah, V shape. V shape, oval shape, heart shape. Nobody like these box shapes. That for a masculine type. For a man, maybe okay. For a handsome man, to show he must be having a box face. She doesn't like it. This kind of. These are coming because of these muscles. The jaw muscles, the side of your jaw, the cheek. So we inject botulinum toxin to relax that. We inject botulinum toxin to relax that. We do this. So this shape become this. We can make it further if you want. Oh no, I want more V shape. We can make it further. But from here to there. Yeah? Chopped out, chopped out. That is with this, injecting the botulinum toxin into these muscles. So you can feel, you everybody have. You close your mouth, clench your jaw, you feel that muscles bulking out. So that's the muscles we are targeting. Look at this girl, very young girl. She doesn't like this face at all. So we can make V or oval shape, this kind of shaping, jawline shaping with a botulinum toxin. Look at this one. Good example, very good example. Yeah? Make it really V. We can make your face. So that's jawline shaping. Similarly, the temple line here, there is a muscle. Sometimes that muscle is very bulky. Then that also gives this look. You don't want that. You want that to be very, from here it should be, it should come like that. You don't want any bulky muscle there. No ladies like. So we inject botulinum toxin there and get a smooth line. So temple line and the jawline. Wherever muscle is too excess, we can smooth it down. Smile. Some people have this smile. When they smile, lip goes to side. This due to the nerve damage. Whether they had accident or surgery somewhere in the neck or lips, and they got damage to the nerve. So when you are smiling, it's go to one side. This side not working. We can make that smile symmetric. No surgery, botulinum toxin. Yeah. See, look at this. The smile is not symmetrical. we can make a smile symmetrical. Another example, asymmetrical smile, make it symmetrical. Look at this, upper lip. This is down, this is up. Make it symmetrical. Another example of upper lip. Gummy smile. This is a problem for the teenagers and the young girls. When they smile, the gum is shown too much. No, the gum should be shown up to this level only. 1 millimeter gum should be seen when you smile, for ideal smile. Right? But if it's seen too much, we call that gummy smile, that looks ugly. This is the ideal form. So we inject botulinum toxin in these 2 points there, make the muscle relax, make the upper lip to come down a little bit. Then it's not going up too much. Simple things. Another examples. Yeah, she doesn't like this. It should be like this. So gummy smile, if anybody showing the gum too much, this is one option. Other option is surgery. This is one option. Paralyzed face. Some people facial nerve is damaged, so they can't smile. When they smile, it goes to one side. They can close their eyes, the eyebrows down, that kind of thing, very asymmetrical. Simply you can make it symmetric. Simply you can make it in a symmetrical forms with the botulinum toxin injections. Come to the leg shaping. You all like to have a very slim, nice, shiny legs. On your hand? Yes. Right. But if you are particularly wearing high heels too much all the time, your calf muscles will go a little bulky. It's like exercising. If you lift, your arm muscles go bulky, and shoulder muscles go bulky. Like that, if you are wearing high heel shoes for a long time, and you can lose this nice appearance of your calf legs. And these are the 2 muscles responsible for that, medial and lateral gastrocnemius muscles. So what we do, like a jaw muscles, leg muscle, we inject this botulinum toxin and relax it and shape it. And shape that. Yeah, simple, there's nothing big here. Earlier I showed you example of shaping the jaw line, temple line, injecting botulinum toxin into those responsible muscles. We now doing with the leg muscle, shape it up. Look at this. For ladies, you don't like this kind of thing. You don't like this, you think it's very bulky, yeah? So make it slimmer. Make it slim. Make it slim. Yeah, from here to here. I say that? From here to here. This is very common problem in countries where the Chinese, Japanese people are living there. Hyperhidrosis, too much of sweating in your armpit. And this is advertisements, yeah? Now it's coming, make it dry, shield. This is, you know who is this actress. So for her, this may be big problems. Yeah, looking nice, but showing this wet armpit. Now very simple to treat. Not only the armpit, hands, groin area, face, head, feet, all have trouble. So this is the trouble, this is the trouble, this is the trouble, this is the trouble. Yeah. So these are coming because of sweat glands. So now we are coming to the glands section. So sweat gland is producing too much of sweat. Then is a trouble. We need sweat glands. Without sweat gland, we can't live actually. But if this is too much, then these problems come. If somebody having this situation, you can't shake your hand, you can write, you can handle instrument, you can computering difficult, things like that. Yeah, and these are very antisocials. This is. So nowadays, goodbye to this problem. We inject botulinum toxin into the skin. We will find out where the area is sweating, and we drop inch by or millimeter by millimeter. We drop it. We put the drops intradermally. Similarly, in the face or any part of the body, we can do that. Hand, legs, anywhere, and get rid of this excess sweating problems. Acne. Pimples. You may wonder what is this botulinum toxin going to do with the pimples. This is the very latest trend. Yeah? Acne management, the pimple management, the botulinum toxin is not alone. That means it is the only one treating that acne? No. This is one of the regime which treat the acne. So with this we may do chemical peel, we may do some topical creams, we may do some antibiotics support, and we will do some laser toning. It's called laser toning for this acne. Laser toning for this acne. So if you look at this, what's really happening in the acne, this is a normal healthy oil gland. Yeah, this is the oil gland. Oil gland. So oil produce, oils come out. Here is getting little bit of block. Little bit of block because of these cells here. And then when it's blocked and still producing, so you get some obstruction there. You call that whiteheads. If that is opened up to the air, it became a blackheads. And if beyond this, the next stage, when the bacteria also go in, we get the pimples. So from here, it's come there, come here. This is, you can see whiteheads, blackheads, pimples. This is more than that, pimples. So at this stage, this one can help, can prevent or help in the management of acne. How does it help? If you inject, when we inject the botulinum toxin into this layer, this level, it goes and tell the glands, okay, don't produce too much of oil, this oil gland problem. This problem, acne come in the problem with the oil gland. So if you inject botulinum toxin here, it tells the oil glands, don't produce too much. Don't produce too much of oil. So half of the problem is over. Still, we need some other agent. As I say, we need chemical peel, we need some topical, we need some antibiotics, we may need some laser tonic, but this is one agent there. And I am now treating more and more patients with this. Look at this, some examples. A severe form. Still some there, we have to continue that. But this helps. Look at this example. This helps. So this is something new. And jawline. You remember I talked about jawline earlier. That jawline problems come with the muscles. Here, this jawline, can you guess what is the problem there? This is very common in males, not ladies.
The saliva gland?
That's right, perfectly. This is due to the salivary gland. So we have a salivary gland called parotid here that become enlarged. This is very common in males who are 45, 50 plus, and if they are taking more alcohol, is common getting, and they are eating more oily food, that kind of social life, they get this kind of face. So their face come like that and bulge here. This is not due to the muscle, this is due to the gland. So in this situation, we will inject the botulinum toxin into the gland and get it shapen. So the jawline shaping may be due to the muscles or due to the gland. So when I put my finger, look at the patient, we'll know which is this case is, which time. Sometimes both. But usually the ladies, that is not the gland, it's the muscles. But the male, usually the gland plus or minus the muscles. So we can catch and we'll treat whether we are going to treat the muscle or gland. Scar revisions. If you have any scar after surgery or accidents, we have to revise the scar. A very difficult surgery. For a surgeon, all the surgeries are easy. This is the most difficult things to correct. 100%. We can do all the big surgery. But this is, we can't say, okay, don't worry, we will correct it. We will never say that. A very difficult problem, this scar revision. So there are so many treatments in this scar. Injecting steroid, laser, chemical peel, dermabrasion. With that, botulinum toxin is one. With that, not alone. Don't think that, oh, okay, with this we can do all the magic. No, it's not. This is one, helping in the scar. Here, it acts in two ways. We get scar because anything under the mark, under the cut. Say if you have a cut here, under that bone or muscles, if that's continuously in action, that area you'll have more scar. So if I have a cut here and cut here, and if you see me after 6 months, the mark here will be better than mark here, because this area always moves. So if you see anybody going through the cardiothoracic surgery, that mark is this size. Because chest always move. There's no rest for the chest. Only once. Then it's gone. The chest always moves. So that mark is always this size. So to answer your question, here, why this patient is getting more mark is two reasons. One, the muscle under this always in action. Facial expression muscles and ladies muscle around the mouth, I think always working. You know what I mean? So yes. So that is one reason. Plus the fibroblast there, that also has some traction action. So we injecting this botulinum toxin, expecting the muscles to relax and the fibroblast to relax. So two way we are trying to contact. Is that the answer you want?
So you would have to do this at the initially, not
right. Usually what I'll do, before I do the surgery, I inject this botulinum toxin 1 week before. Then I do surgical revision of the scar. So there are multiple set plastic, set plastic, small plastic surgery there to remove this scar. Then again on that day, sometime I'll inject a little bit more water. So before I do the surgery, I'll make sure the muscle underneath will be in little relaxed position. So I'll do the botulinum toxin injection a week before. Then I'll do the surgery. Again, sometime I will give Botox, again depend on the condition. I'll assess how much of relaxation in that area. If I'm happy, I won't do it. If I think she or he needs some more botulinum toxin, I'll give another 5 or 10 units. So I remove that part, and this is the results after 6-7 months. See the teacher, so she's always talking. Whether teacher or not, maybe always talking, but she talks always. So this is the results we are getting. Yeah. Look at this one. It's a cut. This we call hypertrophic scar. It's a cut. So we have to do surgery, but that is not enough. Surgery alone will not cure this. Yeah. So we have to inject various things. We do sometimes lasers, sometimes chemical peel, dermabrasion, so many things we do. Here what I did, I remove this scar. Yeah. I put a design to remove. Some plastic surgery there, remove. This is the remove part. The part I remove from this. Stitch that back. So this is the surgical part. But surgery alone doesn't help. So I have injected botulinum toxin along this area 1 week, 2 weeks before this case. And I remove surgically and stitch that back. And this is what we got after 2 months. Right?
Is it permanent?
Yeah, it's permanent. But we had to see follow-up. Sometimes it may behave differently, then we had to act on that time. There have been some more injection, some more lasers, or some more dermabrasion then. Remember one thing, this is God-given skin. If it is damaged, that's damage. I can be the top surgeon in the world. I can't get that back 100%. I can't. But day by day we are improving. Day by day we are improving. Look at some of these cases. Keloids, very difficult to treat. Surgery plus Botox. Surgical removal plus Botox. If I do only surgery, there's a high chance it's coming back. Someday it will come exactly the same way or more than that. So we are scared actually. As a surgeon, we are scared to cut keloids. So we cut and this. Look at this here, from here to here. From here to here. So now, for a scar revision, this is a helping tool. Put it that way, helping tool. What are the cautions? Patients, the public should know. We don't use pregnancy and lactating. If you are potentially pregnant or you are pregnant, we don't use it. And if you're lactating a child, we don't use. But there's no proven or reason why we should not, but we are taking extra care. We don't know.